Recently, Shelley Spence, the Auditor General of Ontario, had a damning report about healthcare in the province with some shocking numbers, including some allegations of $1 billion in potential overcharges by OHIP, and even some doctors who were billing for 24 or more hours of service in a single day. To talk more about this and some of the issues facing healthcare in the province, across the country, the man himself, Paul McCucci. Paul, how are you?
Good, Jim. How are you doing?
Good. Happy holidays.
Yeah, to you too, brother.
You know, I'm a law-abiding Canadian, and like
are.
a lot of Canadians, we follow the rules. It sends my hackles up to think someone could bill 500 patients in a day. 59 doctors could bill 24 more or hours of practice in a day to the taxpayer when we know that the healthcare system's at its breaking point. It's so unfair. They can't get away with this, Paul.
Well, and the interesting thing, you know, and we're going to get into some more details on it, but the 59 was in 2023. So the 59 doctors that were billing 24 hours or more was in 23. Guess what, Jim? It grew to 82 by 25.
Really?
Of course. There's no audits, no oversight, and they don't have to repay the money.
You know,
so, but hold on before you. I just wanted to
please,
because this has kind of spiraled into a huge discussion over the last 24 hours. So when we started prepping this show, we were really prepping it based on the Auditor General of Ontario's report,
a very in-depth report,
yeah, of overbillings, and I spent going through it with Christoph and the team and you hours going through it, and we had a show built, and then all of a sudden, this next report comes out saying we're 6 million doctors short. And the lady that did a really good job. The doctor that did a really good job trying to figure out a set of principles to deal with being short doctors. So she'd done a bunch of surveys. She'd solicited a bunch of input, found out what the hot buttons were with people. And of course, it was lack of doctors. That was the key element. But many more things in that report. On the heels of that, all of a sudden, we get the news that 50% of our doctors across Canada are going to be retiring in the next 5 years.
That is frightening,
right?
50%.
So, and then on the next thing that comes out, this is like a 24-hour news cycle or 48-hour news cycle, maybe. The next one comes out is the federal government now is going to approve foreign doctors and accept their credentials. So they've opened up a new immigration system to bring foreign doctors in, which, Neer and I do a show on immigration, and we've talked about it before. And the interesting part is we've talked about how hard it is to get doctors in on the show. Now they're going to open it up and let doctors in. So, but it's too late. So it's, the horse has left the barn, quite frankly. The problems are out there. So, you look at this and it's a smorgasbord of just crap now, the system, because quite frankly, you got overbilling, you got shortages, I don't know what to think, Jim. Honestly, I look at the stats because I'm an accountant by trade, and I say to myself, okay, Ontario has 459 patients per doctor.
Correct.
Right. And Quebec has about 400.
Right.
High threes. We did that show on Quebec, which was a great show. And I thought they were on to something. I think you and I both agreed. They had some principles, but it wasn't there yet. So, you look at it and you say, okay, the math doesn't work. Okay, math doesn't work. There's not enough patients per doctor currently, but yet we need more doctors, but yet we're overbilling. Okay, now we're going to bring in foreign doctors. What the heck? Can we not get a strategy here? Can we not lay down some track and try to get something that works?
Paul, I don't think there's anyone watching or listening to you right now that doesn't agree that there's something wrong. One of the first things people talk about being Canadian, they talk about this and that, and they talk about our healthcare.
Yeah, free healthcare.
Free healthcare. It's like it's the envy of the free world, right?
Yeah.
Like look at our free health. It was. But it can be. With proper management, proper oversight, proper distribution of funds, it can be again. But someone has to step up. And we were just talking before the show. If Doug Ford stands up there and says, you know what, we are going to find all the people that overbilled and hold them accountable, that could be the end of his political career.
Well, yeah, but okay, so now you have an ophthalmologist, right, who actually billed in 24 $6.7 million. So, he's saying that he was seeing 233 patients per day.
That's not possible. That's not humanly possible.
No,
I go to my eye doctor.
What's that? Every minute?
That's
sorry. That's like crazy. It's not even.
You're lucky if you can get through your appointment in 30 minutes.
Well, we had a diagnostic radiology. We had who billed $3 million, right? Which is very interesting. Is saying that they had 728 patients a day, which I think someone translated before the show. They were seeing a patient every 2.2 minutes.
Well, I've had x-rays. I've had an MRI. Yeah. That's not possible. That is not physically possible to get your x-ray done and your MRI done in that short a time.
I'm with you. But, honestly, we have GPs that are billing $2 million and they're saying they're seeing, 731 patients in a day.
We are so regulated in Canada, in Ontario, across the country for everything that if something seems untoward, a red flag comes up, whether it's transportation, business, Bay Street, broadcasting. There's a red flag that comes up and someone reaches out to go, hey, this doesn't seem right. How is it possible that a red flag hasn't come up with this?
There are no red flags.
But right.
So they shut them off. So the red flags, the audit process got shut off years ago. It's an honor system. And there's no monitoring, no analytics looking at these billings.
So obviously 95% of the doctors are adhering to the honor system and 5% realize, well, if no one's going to check, I can just do what I want. And they are.
Well, and I think the number's higher, unfortunately, Jim. I don't think it's 595. I think it might be quite a bit higher. So because quite frankly, when you look at the numbers, and again, the number of patients per doctor, and you look at the billings, and this is where, pardon me, the provinces and the provinces and the country, Canada, has put way more money into healthcare.
Oh,
so
absolutely.
We've upped it to the point where we're in the top 5. I've talked about this on previous shows. We're in the top 5 in healthcare spending. We exceed a lot of other countries. And you look at, like you were mentioning before, Denmark.
Yeah.
Yeah. We're below them, but we're not far below them. But they have way more doctors than we do. They have almost double the number of doctors per 1,000 people.
And they don't have these 8 months before I see a specialist or 9 months till I get my hip replaced.
But when we went and looked, they also have an audit process. So let's say, if we go through and we take a look at the countries that we went through, and we looked at probably about 6 or 7 countries, and they all have audit processes. They have AI analytics. Like in this day and age,
you were mentioning Australia particularly had a really good system.
Well, Australia. So here it is here. They have an AI provider powered Medicare fraud analytics, real-time risk scoring for providers. So if you bill so much, you go into a matrix and that matrix pops up and they send a letter to you and you have to validate your billings. That's right. Almost instantaneously, Jim.
So say your billing is $450 consistently, all of a sudden it spikes at 1.8 million. You're like, whoa, that should raise a red flag.
Yeah, well, it should on a monthly basis, right?
Right.
If you're 24-month average, if you go above it, it should say, ask why you went above it.
Yeah, what happened?
What happened? What was the thing? So, and the interesting thing is what we had, quite frankly, I don't know if you remember this, but I got a couple of these letters years ago, and this was, oh God, I probably was in my 40s. And it said, were you at the doctor on such and such a date? And it was a check the box.
I never got that letter, but you did, eh?
Yeah. And you took it and you checked the box and it was paid postage.
Okay.
You put it back in the mail and sent, and that was our audit process.
Right. Okay.
So that was, and we did do it for a while, and then we shut it down, went to the honor system, and then we have if something does pop up now, if someone's doing it and it does raise a red flag, we have a tribunal, for the provinces. They sit down with the doctors. The doctors in Ontario don't have any requirement to pay the money back. So if they overbilled and they're found to have overbilled, there is no requirement they pay the money back.
So why even have a tribunal?
They on their honor system settle.
So if I owe $3 million and I give you 50, then I'm settled? Is that considered case closed?
If you're okay. Not if I'm okay. Not if I'm the,
If I'm the doctor,
not if the government. If the doctor's okay and he's okay to settle that amount, then it works.
why would you ever stop cheating if you can get away with it every year?
Well, that's the issue. So in New Zealand, they have a nationally integrated patient and billing system with that flags anomalies instantly. They have an automated fraud detection in the UK and digital documentation standards. Well, wouldn't that make sense? Wouldn't it make sense is when you went in and swiped your health card, if both you and the doctor were aware. So, and it was registered. So that would be registered. So you'd get an email saying you visit the doctor on this day.
Yeah.
Isn't that easy to do?
And you hit confirm.
Yeah, I did.
Yeah.
And then that visit gets validated. Boom.
We have confirmations for everything.
We do.
For every single thing, I have an email confirmation. So, Paul, here's my thing at the end of the day.
Yeah.
Beyond all the numbers.
Yeah.
Canadians believe in fairness. We do. I'll pay my taxes. I'll go the extra mile.
Yep.
But to find out there are doctors abusing the system, abusing the honor system, overbilling so that you can't hire more doctors and more nurses and more radiologists, that offends me. And something, this is where the government, you say, well, we don't want more government. Well, there's sometimes you do need the government and you do need oversight. And this is one of them.
Well, and it's interesting because I say this on a lot of shows, Jim, given where we are, given where the status of the country and financially where we are, and, with the US and tariffs and everything going on, we are at the point where we can't keep doing these things. So what's happening, what you're seeing, and this is very interesting, how you look at the last 24 hours. I think people are kind of getting that now. Like, okay, this might have been status quo. I was kind of monkeying around with this. Everyone was doing good. We were all killing it. Well, now we're not, right?
And a lot of the truth is coming out.
So now people are starting to say, well, time out now, right?
Yes. Yes.
Not only do people not have doctors, now we can't afford as a country to do this anymore. So interesting. And I thought it was kind of oddly played in the report that came out. All of a sudden, we're now hearing that the doctors are retiring. I'm like, oh, that's kind of weird. Like, is that just happen chance, or was that like saying now, okay, we're not probably going to get our way on a bunch of this stuff? So
that's a great question. Whether it's coincidental or intentional.
I don't know. I hope it's not. But quite frankly, it did raise a lot of red flags when I saw it. I was like, oh, this is very odd. And within a 24-hour news cycle, we've had overbilling. We've had, the studies on lack of doctors. And now we have retiring doctors. So we have all this in a short period of time. It's like, okay, come on. So how do we overcome all these things? We got to get a system in place. We need to get, and we should be able to, listen, we're very technologically savvy. We're a very smart country. We should be able to quickly, we're not a huge country. We should be able to quickly get health cards that have the capability issued to everyone that we can validate visitation to the doctor.
Every time I go I've had to go to the hospital or doctor, first thing they do is they swipe my information.
Yeah, they do, but it doesn't, where does it go?
I just assume it goes in their database to indicate that I went.
Well, it goes into their database and then they create a billing form. And apparently, from what I'm hearing, the number of codes for billing in Canada are outrageous across the country.
With a variety of codes?
Oh yeah, it's silly. It's wacky doodle. Apparently it's so crazy. This was the Quebec. Remember the Quebec group? They complain. They're like, it takes me 5 hours to bill because I have 93 different subcodes.
Which is ridiculous.
Yeah. So they were trying to get that sort of fine-tuned. But here's the other thing. So, and I wanted to go in this too. Okay. Foreign doctors. And you picked it up at the beginning of the show. We remember our lifetime getting in a cab. I think everyone had this experience. Hey, where are you from? Oh, I'm from. What do you do back home? I'm a doctor. Oh, okay, great. And this went on for years.
Pure later delivery, like it's everywhere.
Yeah, I remember having these discussions. It was probably a decade ago. They were more prevalent. Like you had a ton of them. Every person that was driving you in a cab or an Uber or whatever, quite frankly, was a doctor from somewhere or something. So, you used to have a lot of those conversations. But now we're going to open it up and we're going to bring more doctors in, which I'm all for.
Mm-hmm.
how about starting to focus again on our own population?
Sure.
Like, so we have a bunch of kids here, and I know, from my family, I know listening to the kids, how hard it is to get into medical school.
Brutally hard.
Brutally hard.
Yeah.
So we must, and this is kind of the interesting thing, and the health ministers, whether it be the federal health minister, or whether it be the provincial health ministers, guys, right? You must be driving to work. So I can imagine you're driving to work and you're saying, okay, what are my top 10 issues in my portfolio today? Number of doctors. I think I'm going to put a schedule together to figure out when the doctor is going to retire and what my attrition on doctors is going to be.
They do it for everything else.
Well, obviously, but they didn't do it for this, because all of a sudden, yesterday, we're getting this news that in 5 years, 50% are going to retire. So I'm like, how did we miss this again? Well, and it kind of the same thing. In this overbilling report, we had to write off $1.4 billion in PPE. Billion.
1.4 billion that the healthcare system can't afford to write off.
Right. So all of a sudden, well, I guess we junked it. I guess we threw it. I guess it was stale dated. I guess we decided to, it gets put into a landfill somewhere. That's
How many
ridiculous.
nurses? How many radiologists? How many doctors with 1.4 billion?
Well, that makes no sense to me. And the accountability of it. Who are we holding accountable for that? So as we're driving to work and we're saying to each other, saying to myself, my portfolio is health. I better make sure there's enough doctors today and in 5 years. I better make sure that inventory of PPE is kept current. Like, there's not that many things on your radar. Like, quite frankly, come on. The checklist has to be like 50 things, and you have a staff to do it.
So I know Cordalucci Vaughan Hospital in Vaughan, Ontario, just opened a medical school dedicated to family doctors.
Oh, great.
Which is great.
Yeah, it's awesome.
But unfortunately, it just started. So you have a Bachelor of Science, you go into that med school. Well, that's years before you get into the queue.
Yeah, 8.
Right.
Yeah.
I mean, you have
6
to do
to 8, yeah.
So the thought is you could do your internship right at Cordalucci Vaughan Hospital, do your internship, and then go into practice. But yeah, they're starting behind the 8 ball, bringing in doctors when they talked about this 25 years ago. They knew they had an issue. Starting to expand med schools dedicated to family doctors. They knew there was an issue decades ago, but now they're playing catch up. But like you say, they don't just like 2 years from now start practicing. It'll take years.
But no billing systems, no accountability for the number of doctors and when the attrition's happening, no audit processes. Jim, we're a developed country. Are we?
Paul,
we were proud of healthcare. To your point earlier, we were proud of our healthcare system. We bragged about it. We traveled around the world and said, we pay a lot of taxes, but we have a great healthcare system. Well, but it's funny, you talk about this, and I brought it up on other shows. I remember as a kid, because, living downtown, we grew up Little Italy, and, worked down there. I remember, they always say, don't get hurt in the summer. So we used to have this conversation because there are no doctors.
They're on vacation.
Yeah. So basically, so in the month of August, everyone would kind of make a joke. Don't go to a hospital in the month of August. So if someone kind of did, everyone was like, oh my goodness, poor person. They're going to go to the hospital today. It's August and there's definitely not going to be any doctors. Right. So we always kind of joked about it. And there were times of the year we knew there were going to be no one in the hospitals. And we kind of just, but the population was low.
Yes.
And we all had family doctors that we kind of knew.
Yeah.
And they were old guys that we kind of.
And they served your family for decades.
The family knew them. Everyone knew them. They were trusted. We had this great relationship. And then all of a sudden, boom, that exploded. If you think about it, we got a lot of clinics. So we went to clinic healthcare. And then, which I have a family doctor, but it is through a clinic. And quite frankly, it seems like that was the downfall. It seems like when we got there, everything kind of fell apart, which is when you looked at what happened in Quebec, that's where they said things fell apart, right? What happened was there was a bunch of closed clinics that weren't open to the public. And then what happened was over time, there more and more and more. And then 2 million Quebecers were then kind of excluded. They were kind of left out of in the cold to go to the hospital or go to a limited number of open clinics. And then it evaporated on them. And, billing the Ontario numbers, I don't know, billing wise, there hasn't been a report in Quebec that I've seen or read, but the Quebec numbers are very close as far as spend per cap.
Right.
To Ontario. So I assume some of the billing issues probably spill over there because the numbers are close, right?
My family doctor is part of a health team. I think there's 5 or 6 family doctors in a shared office to reduce office costs, insurance costs, and administrative costs, because that sucks a lot of their money. Then they also have malpractice insurance. So that's pretty common for a lot of family doctors I know now, is it's 5 or 6 family doctors in a health team. And in the case like, hey, I got to see my doctor, and Dr. Christoph isn't available, I'll see Dr. Paul, and they'll be able to take care of me. Yeah. But they can only see so many people in a day. And I know there's also a clinic in Newmarket that's opened up, and a lot of people who don't have a doctor or need to go somewhere quick, they go see this physician in the clinic, and they go, no, you need to go to South Lake, you need to go to St. Mike's, you need to go to this hospital.
Right.
And I don't see any problem with bringing in these foreign doctors, qualifying them, and opening up clinics. There are so many problems and so many communities in this country, Paul, who don't have any family doctor. And there's actually a story that came out that there's some small town communities are giving bonuses to entice you to move to their area to practice.
Yeah. And I'm just going to add a little bit onto that. Well, increasing our training in colleges for Canadian citizens. Mm-hmm. So I'm going to say, so as a stopgap, I think it's a great stopgap to bring in foreign doctors, make sure they're qualified.
And open it up to more Canadians.
Yes.
I couldn't agree more.
So, because, you think about, we have this conversation all the time. We have a bunch of disenchanted youth who are sitting around, who are overeducated right now.
With nowhere to go.
But yet we have a shortage of doctors. It makes no sense. The comment, it doesn't make any sense. So our healthcare providers we're in short need of, and quite frankly, it looks like we're going to be even more. So to me, it seems like a perfect fit. It seems like a logical, but again, to your point, no one wants to touch this hot potato.
No.
So here's the thing. Here's my recommendation, how to touch this hot potato.
Okay, Premier Micucci, tell me.
No, no, I don't want to do that. Sorry, it's all right. So go to the other countries, look at the models, number one, to right size the billing system. So I think the first thing you got to do quickly is you got to go somewhere and you got to say to someone, do you have a system, and how do you bill, and does this work, and does it prevent all this craziness? So let's get the craziness out of the system.
Right.
Because these crazies, quite frankly, it worries me, quite frankly, that some of these people and the numbers in this billing report are even practicing on people.
Well, absolutely.
Yeah. Because
what is their standard of care?
Well, what's their standard of care? And if you're willing to do this to the healthcare system, I kind of question some of your ethics, right? So let's put that aside, right? Those people have to be dealt with, but they'll be not dealt with directly. They'll be dealt with by fixing the billing system. Go to the colleges, take some of the money that you've allocated through the 25 budget. You've got all these major projects. Rather than, let's do this for a minute, rather than a major, because all the major projects we hear about, mines, refineries.
Yeah.
So we talk about all these things, right? Military. Let's make the overhaul of our healthcare system a major project.
Absolutely.
Why do we not ever say that?
I don't know.
Well, let's say it.
So
let's start to say it. Let's just say this is broken. It's a mess. Let's all kind of look at each other and say, we really screwed this up.
And every province, we're going to build something.
Mea culpa. Let's figure it out, right? Let's get over it. It is a disaster right now. Let's one by one kind of put the building blocks back, and let's not do it individually. Let's not go across all the provinces, territories, and try to make our own concept, because, we've tried that before. It doesn't work. The money gets transferred from the federal government.
Yep.
So let's try to do it. But let's go and actually get that in play. Then the second thing is, as we get that in play, let's get our training centers for our Canadian citizens. Let's get that working now. So let's figure out how many doctors are going to retire. Go to them. Just say, when is your end date?
And do the math.
Yeah. When's your end date? When is the last time? When are you closing your practice and you're disappearing from Timmins?
What? Toronto
Okay.
Police Service, Chief Demkew, they just had a whole hiring increase because they looked at the attrition for the amount of police officers, and they say we need to hire this many officers just to break even. Well, they have the same problem in healthcare.
So let's get on it, figure
Yeah.
it out, get to the colleges and universities and figure out. Nurses we haven't even talked about.
No.
Right. So the nurses, quite frankly, I think when we hear about the overworked healthcare system, I think we're really, for the most part, talking about those poor nurses who are run off their feet, quite frankly, trying to just patch it all together one by one.
And they don't make anything close to a doctor, Paul.
No, cripes. Well, they don't, these numbers, cripes, these numbers, they don't even come, they don't even get in a lifetime.
So the nurse can't overbill. The nurse can't bill for no service. The nurse has a set wage that's negotiated on, and that's what they make.
Right.
And they work ridiculous hours. And the mental and physical burnout for the nurses in this country, it's frightening.
And then, Jimmy, the final pillar, which we haven't even talked about, we're going to talk about on another show. Let's dig into our administration of our healthcare, right?
Yeah.
So we just got to get that right size, because part of, when we talk about billings and we talk about doctors, we talk about nurses, the administration and the infrastructure of our healthcare, it needs work.
It could be more streamlined and more efficient.
It could be way better, right?
Absolutely.
Our buildings, our technology, like all that stuff just is lacking. And it's not for funds. So let's be sure, because everyone, the one thing people say to me all the time is, we need to put more money into healthcare. Well, even the premier of our province here in Ontario, he said it several times. He says, listen, and he sits there with this kind of beleaguered look. He says, I just put 20 more billion into it when I got in. What do you want me to do now, right?
So you tell me, in all your years,
is it like schools, do they have to come in and take it over?
In business, in all your years, you've met so many uber successful people. The one thing they all have in common, I know from the ones I've dealt with, they're not so arrogant that they don't see a good idea and look at it and try to implement it, or try to be better and get better and ask for help. And we have to get by this national arrogance about healthcare, that we have the best healthcare, and look at Denmark and Australia and other countries and see what they do. And like, you know what? We could be better here and here and here, more efficient, have more access, more doctors. Until we get through that, Paul, until as a country, we as a national mindset don't automatically try to throw someone out of office because they bring up the idea that we need to maybe tweak and revamp and improve our healthcare. How can it change? Because right now, all politicians are afraid to do anything like that.
So, and that's where, I really think you got to start in small chunks.
Yeah.
So you start with the billing. You have to start being very blunt with people and explaining to them, our healthcare index is like 30th in the world. We're like very low. So when you look at all the parameters that look at all the parameters of healthcare, they rank against other countries. We're in the bottom quartile right now of developed countries. We're in the top quartile for spend. So the two don't equate.
So how do we bring it closer together?
And then you just have to keep sending that message and keep sending that message. And then you get one by one, you start tackling the pillars of this problem.
But it's become such a third rail politically in this country that no premier and no prime minister, no politician is willing to stand up in front of everyone and confront some of these issues. So it keeps rolling over and rolling over. And they do little dribs and drabs to say, oh, we're going to have some more family physicians and we're going to bring in a little bit of this and that. But the problem isn't getting smaller.
No, it's getting worse. And quite frankly, it's going to get worse if they don't tackle it, as you can see.
And the numbers, I get back to how I'm upset. I don't begrudge anyone making a fair wage, especially as a heart surgeon and a neurologist and radiologist and what they do. But when you're overbilling and you're saying you're billing 500 patients in a day, that's an insult to Canadians, an insult.
It is. And we got to fix it.
Absolutely. Paul?
Thanks, Jim.
He's always got the answers. Listen to him.